Good morning, Sunrisers. I'm Dr. Karen Emerson, and this is David, our kennel manager, and this beautiful cat he is loving on is Lexi. Lexi is a 3-year-old domestic shorthair black cat that presented around December, and what happened was her mom noticed that she just wasn't feeling well. She started hiding under the bed, not coming out as much, having some really black tarry diarrhea, and this let her know right away something's not right, because I know a lot of you cat owners out there, you know when your cat's routine gets off and they start acting differently, that's them telling you, hey, I'm not feeling good. So I'm so glad they went ahead and brought her in that day, because we did blood work and we found out that Lexi actually did have an infection and her glucose was elevated in her blood. It was up in the upper 200s. So then we decided to do a fecal and we did some testing, and then we tested her urine. Well, in her urine she had a very, very, very bad infection, and it also showed she was shedding glucose in the urine. I'm sure a lot of you are diabetics out there, and when your body is not compensating well and you have diabetes and the pancreas is not working properly, the body will get rid of that glucose through the urinary tract, and all that glucose was spilling in her urine, causing her to have a really bad urinary tract infections, and urinary tract infections are severely painful. But Lexi was the most awesome cat. She let me go in there and get urine via cystocentesis, and all that means is I pulled it out sterilely, let us do the exams, and we decided that day to start her on an antibiotic, so we did that, and then we waited a little bit. She brought her back that next week. We did another urinalysis. We saw she was still shedding glucose and that her glucose was elevating in the blood. So what we decided then was to continue the antibiotic, and instead of starting her on insulin right away, we started her on a diabetic cat food. I bet you're like, oh my gosh, they make diabetic cat foods. Well, they do, and this is actually it. And we also have other brands that we use because we try to find the brand that your cat will eat. So Lexi started eating the diabetic cat food. She came back several weeks in a row for injections because she's just not good at taking oral meds. Well, after about the 4th or 5th week, she came in, everything was regulated, she was doing well on the cat food, she's urinating properly, she's eating, she's happy at home. So just because you have a cat that may be diagnosed with diabetes, it doesn't mean you may going to have to give your cat insulin injections every day, because if you're a cat owner like me, that seems pretty dreadful, especially with your kitty cats if they don't like it. So we do have other alternatives out there, things we can do for your diabetic cat. But if you have a cat at home that keeps urinating often, hiding under the bed, not eating normally, having diarrhea, that cat's trying to tell you, hey, I don't feel good, I'm sick. Please give us a call, make that appointment. It will change your cat's life and yours, and I promise your pets will thank you.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.